they have obviously their international lab, that has kind of been at the forefront of the response efforts for the last outbreak, and obviously will form the core of the current outbreak response efforts. But a lot has been put and invested into to the local capacities within the regions, and very kind of fortuitously, they have I think good capacity within the region that's directly being affected right now, to at least be able to provide some if not a lot of diagnostic capacity to be able to recognize these cases. And obviously they've got the historical context, which I think is important as well. They've somewhat been able to, with the tail end of the last outbreak, been able to reposition, the vaccination campaign very quickly to focus on the new region. They've been able to get people out, or at least get people out of the villages to provide vaccine for thousands of individuals so far. So to me, I think they're actually in a very good position to be able to try and get this under control fairly quickly. It's not an overly violent region. They haven't seen as much kind of political strife, as what they've seen in the eastern region of the country. So again, hopefully all of these things, will help with limiting spread. On top of the fact that I think, to be fair, COVID-19 in the background, and having, I think, that lingering threat as well, and obviously having a public that is as attuned to social media and to international news as we are, and have the same capacity as us for getting that information. The likelihood is that they are also trying to implement different procedures at the ground level to limit spread of COVID-19, which likely will also have ramifications for spread of Ebola virus as well.
Yeah, so as Dr. Kinderchuk said, there's not much that has been released yet in terms of this current Ebola outbreak. We know that it represents a new event. We know that it's in an area that has previously been affected by Ebola in terms of, the number of cases and the number of contacts and those types of things. There hasn't been a lot of information that is known just yet. I know that, the WHO has teams on the ground that are assisting the local Congolese. They're also using many of the same infrastructure that was developed during the most recent outbreak. And as I mentioned before, they're using the vaccine that was also developed during the prior outbreak. I think that in terms of trying to contain this outbreak, because it's not an area that is known to be heavily violent, like Eastern DRC, it hopefully will come under control in a much easier fashion. I do think that when you are responding to Ebola in an area where you're dealing with a number of the other issues that have been discussed, such as a very large measles outbreak where I believe there's been over 65,000 deaths. You're dealing with cholera, you're dealing with COVID-19. So there are a number of other challenges that are being addressed at this time. Additionally, my understanding is that some of the terrain in the area can make it a little bit more challenging. So there definitely are challenges. I think that, given the ongoing global situation with coronavirus, we just haven't heard as much about it, and the information has been less forthcoming. Hopefully, as the WHO and other organizations learn more, we will also begin to hear more.
And you both pointed out that it's not the same to have this outbreak occur somewhere that's not embedded in the Kivu conflict, which, though many people haven't heard of it, that's a decades-long, on and off, hot and cold conflict zone, and very complicated background to it that it's very hard to parse for a lot of people who aren't familiar with the region. And that almost seems to represent a microcosm of that global wealth disparity issue that was coming up at the beginning of what we were talking about, that even within a country, we have this abstraction of the third world or something, or we used to. I think a lot of people have moved beyond that now. but it's not a blanket even within the region about what the healthcare capacity is going to be and what the background disease situation is going to be.
Yeah, I agree. I think, I spent, quite a bit of time in Kenya in the past as well. And Kenya is a perfect example where you do have, a lot of wealth disparity that is coming into play very quickly as the economy has been moving forward. And trying to address that from the auspice of public health becomes even more difficult. And I think, again, that's where trying to have that representation of local community members in these response teams is just so critically important with this ongoing situation in the DRC. Like you said, these are decades long conflicts and disagreements that have been going on. That I think, unfortunately for us, we aren't going to be able to understand. Kind of the much kind of much rooted differences and disparities that have been presented by that. So I think, again, we have to just be so reliant on local community members to help guide those response efforts, so that we actually are able to address the situations at hand.